Welcome to the Skin Crest Clinic Dermatology Podcast. I am your host, Dr. Praveen Banodkar, consultant dermatologist practicing in Mumbai at Skin Crest Clinic. I thank you for joining the podcast that covers everything related to skin, hair and nails. In this podcast, we would be discussing about eczema in children. Children with eczema or atopic dermatitis tend to get patches of dry, itchy skin. This itch can be so uncomfortable, it interferes with sleep, making your child feel miserable. Plus, scratching can cause open wounds that tend to get infected. While there is no known cure for eczema, the condition can be treated so your child feels better. There are ways of helping your child avoiding eczema flare-ups. For example, by moisturizing the skin extremely well and repeatedly. Eczema treatments usually target 4 common problems: dryness, itching, irritated skin, that's inflammation, and infection. For children with eczema, the skin barrier isn't holding in water well. There is a disturbance in the barrier of the skin. The skin is normally divided in 2 layers. Top layer is called the epidermis and the layer below that is called the dermis. The skin becomes dry and cracked when this particular barrier between the epidermis and dermis breaks down. Dry skin also is very itchy, and hence gentle skin care daily is important to improve the skin barrier. As a part of this program, give your child a bath every day for 5 to 10 minutes in lukewarm water. Do not use harsh detergents, soaps. Do not use very hot water for bath. Avoid scrubbing the skin with anything rough. Don't use bubble bath in the bathing water. Preferably use a bucket of water for bathing, because a shower use on the skin tends to cause more dryness of the skin. Pat your child's skin dry after the bath or shower. Apply a moisturizer to the whole body immediately after a bath. This helps to lock in the moisture of water. The creamier the moisturizer, the better it will work. Dress your child in soft fabrics like 100% cotton. Use mild, fragrance-free laundry detergents. Preferably, do not use fabric softeners or fabric sheets in the dryer, as they might cause an increase in the irritation of the child. Reducing the itch with good use of moisturization. Reducing the itch with gentle skin care and use of moisturizers is very essential. Try to stop your child from scratching as much as possible, since scratching can make the skin feel even more itchy. Keep your child's nails cut short. Wearing cotton gloves at night can help tremendously. Wet wrap treatments. Apply wet wraps after bathing and applying topical medicines and moisturizers. Apply the prescribed medicine given by your dermatologist to the areas of the rash and apply the moisturizer to the surrounding skin as well. Make sure the room is warm and provide a warm blanket in case your child is feeling cold. Keep the wet wraps on for at least half an hour or leave them on overnight. After removing the wet wraps, reapply the moisturizer. Antihistamines like hydroxyzine or similar kind of antihistamines can be given. However, they do cause drowsiness and should be prescribed by your dermatologist. Topical steroid medications or non-steroidal eczema medications like tacrolimus, pimecrolimus, crisaborole ointments can help the irritated skin, and these are normally prescribed by the dermatologist. Bacteria and viruses can make eczema rashes worse, and hence it is very important for you to look into infections. Look for oozing, crusting, pus, blisters or worsening of the rash, and make sure that there is no infection. Infections can require antibiotics or antiviral medications. Once your child is no longer itchy and areas of the rash are smooth and soft, you can start to use the medicines less often. Since eczema is an ongoing skin problem, it is important to continue your routine of gentle skin care and use of moisturizers every day to minimize the future flares and infections. Gentle skin care prevents future eczema flares. Some triggers that can be avoided include dust mites by keeping the house dust-free, fragrances like keeping the child away from perfumes, colognes, air fresheners, candles and incense, heat and sweat, insect bites and sting by using the appropriate insect repellents, avoiding wool and synthetic fabrics. Hope you enjoyed listening and gathered some valuable take-home messages in today's discussion. Thanks for tuning in. For dermatology appointments, you can send a WhatsApp on 9867 955 944. Take care and stay healthy.